everybody. Welcome. Thanks for joining us. As you're settling in, would you do us a great favor and go ahead and adjust your username? You can see where, like under me, it says Lindsay Wahowiak. I'm going to go and adjust mine and say, just put what state you are from in addition to your name. So the way you do that is you hover over your own face, your name, as it were, on the screen, and you should get two little blue boxes. One says mute and one has 3 dots. Click those 3 dots and it says rename. So I'm going to put Lindsay Wahowiak and I live in DC, and you will see that there. So if everybody can go ahead and update that. Jordan, I'm making you a co-host just so that you are aware.
Thank you.
Sure. And as folks are coming in, if you missed my first welcome and hello, if you could, please go ahead and hover over your name or photo, whichever you see on your screen, and you should see 2 little blue buttons. One says mute. You should all be muted right now, so that's fine. We don't touch that one. But the one that's got 3 little blue dots, I want you to click that. And then where it says rename, add your state to your name. So who you are, where are you from? And I think if we give ourselves just a couple more minutes here, because I think we've got 34 people right now, and I know we had 70-ish affiliate leaders said they were going to be joining. Although I'm sure a few of those are going to be tuning into just the recording. But I see a lot of familiar faces and some new faces. And I'll keep letting people in as we go, but Don, I don't know how much time you need, if you want to get started right away or if you want to give it a couple minutes.
You're muted, Don.
I will never learn how to use this system. We have quite a few slides, but some of them will be quick. So maybe we can wait another minute or 2.
Okay. No problem there. Yep. And for the folks who are just joining us, oh, I see at least one is connecting to audio, so I'll give it a minute so I don't give the same speech to everybody who's already seen it and heard it. But hello, y'all. If you are just joining us, if you would do us a tremendous favor of going into, if you hover over your image or your name on the chat, and not on the chat, on the screen itself, and you should see 2 little blue buttons. One should say mute or unmute, depending on your situation, and one should be 3 little dots. If you click that 3 little dots, hit rename, add your state to your name so we know where you're joining us from. This way we'll be able to find folks in sections and on the action board and within our own affiliate who we might be able to connect with. Okay, and without further ado, I think as people join in, they'll just be able to catch up. And we've got, of course, the recording going. But I want to thank everybody for joining us for our first Summer of APHA webinar. And I'm going to hand it over to my colleague, Don Hoppert, and also Jordan Wolf. They're going to take it away and talk a little bit about advocacy. So, yeah.
Thank you, Lindsay. And I'm going to kick off the presentation. And then I'll turn it over to Jordan to finish up the second half of our slides. So I'm going to go ahead and share my screen, hopefully correctly. Start. All right. So this presentation is going to be primarily focused on our Speak for Health campaign. That's our annual advocacy campaign. And I guess I should say we're going to hold the questions to the very end, if you don't mind, so we can get through. We have got a lot of slides. So if folks don't mind, that would be our preference. Anyway, our Speak for Health campaign, for those old timers who've been around forever, this formerly was known as our FACT campaign, our Public Health Action Campaign, but we've rebranded it several years ago to fit under our Speak for Health messaging. So I will go ahead and start. Just a quick overview of our priorities, advocacy priorities for this year: strengthening funding for public health, supporting efforts to address the impacts of climate change, supporting innovative efforts to expand access to comprehensive affordable health coverage, support public health approaches to address gun violence, and maintain strong public health regulations. And with our first issue, public health funding, our goals are to increase funding for the Centers for Disease Control and Prevention and the Health Resources and Services Administration for fiscal year 2021. We also will be opposing harmful policy riders or other efforts to block funding from critical public health services funded under these agencies. Just a quick overview of the process and kind of exactly what funding we're talking about. When we talk about CDC and HRSA, we're talking about discretionary public health funding. So these are the funds that most public health agencies and programs nationwide, including CDC and HRSA, receive each year. This type of spending must go through the annual appropriations process, and the money cannot be allocated without congressional approval. A quick overview of the process on how it's supposed to work. That's the key there, supposed to work. Doesn't always work this way. Oftentimes, more times than not, it doesn't follow this exact process, but this is how it was envisioned. The president generally releases his budget the first week of February. Congress then holds hearings in March and April on the president's budget and expresses their views. Between April and June, House and Senate appropriations committees begin working on their legislation. In June, the House is usually finishing up its appropriations bills, the 12 annual appropriations bills. And then between July and September, the Senate will complete its action, and the House and Senate will work together also during that time to work out any differences between their versions of the spending bills, so they can finish them by September 30th, which is the end of the fiscal year, and then the president can sign them into law. Of course, that rarely happens. The schedule is often not followed. As you all know, we're now in July. The House actually has marked up in committee all of its appropriations bills, but the Senate has not even started. So we're very likely to end up under a continuing resolution for at least part of this year. Very unlikely that Congress is going to get its act together and get all of the bills passed by each chamber and then conferenced for final agreements by the end of September. The landscape in 2020, the current fiscal year, there were some good increases for CDC and HRSA. So in FY 2021, of course, APHA is asking for more for CDC and HRSA. We do, as I mentioned, the House Appropriations Committee has passed its spending bill, and it did provide an increase for both CDC and HRSA. CDC would receive an additional $232 million for a total of $8 billion. In addition, the House bill would provide an additional $9 billion in emergency funding to address COVID-19. The House bill also provides $157 million in additional funding for HRSA. Sorry, and that's a little glitch there, for a total of $7.2 billion. And Senate spending, as I mentioned, unclear. We're not sure when they're going to start or when they will finish. So stay tuned for more information on that. In 2019, Congress did pass legislation to raise the budget caps, averting a 12% cut to non-defense discretionary last year. Unfortunately, once again this year, the president's budget did propose a lot of cuts to both CDC and HRSA and many other public health programs. APHA worked very hard to raise those budget caps and to oppose the president's proposed budget cuts. But even with these higher budget caps, funding, especially when you factor in inflation, funding definitely remains below 2010 levels. A lot of attention obviously has been paid by APHA and others to COVID-19 related legislation. So far, Congress has passed, the president has signed 4 different bills. On March 6th, the president signed the first bill, the Coronavirus Preparedness and Response Supplemental Appropriations Act. On March 18th, the president signed the Families First Coronavirus Response Act. March 27th, the president signed the Coronavirus Aid, Relief, and Economic Security Act. And then on April 24th, the president signed the Paycheck Protection Program and Healthcare Enhancement Act. Now, the House back in May did pass a 5th bill, a $3.5 billion supplemental funding bill, but the Senate has not taken up the bill, has not yet put out its proposal. We do have a great summary of the bills that have been signed into law to date that my colleague Jordan has put together, and we've linked to that in the slides. So I encourage folks to visit that document and take a look at some of the details of the various provisions that were included in these 4 bills that have been enacted thus far. APHA and many other organizations have additional asks for future legislation, but just to highlight some of the ones that APHA has continued to focus on, providing an additional $4.5 billion in annual mandatory public health infrastructure funding that would go to CDC, state and local, territorial, and tribal health departments to really build their core capacity in a variety of areas, so they would strengthen the ability of those health departments to address not only emergency preparedness in COVID-19 and those types of issues, but also chronic disease, other infectious diseases, environmental health issues. So really strengthening those core capacities that are needed for the public health workforce and departments to really address all of the challenges that we face. We're also asking Congress to invest in building and strengthen the public health workforce by enacting and implementing a loan repayment program for public health. We're asking Congress to provide additional resources for contact tracing for state and local health departments. We're urging OSHA to immediately issue an emergency temporary standard to protect all workers from exposure to COVID-19. Unfortunately, OSHA has opted not to do that. However, Congress could pass legislation compelling OSHA to do that. So we are asking them to do that. We're also asking them to strengthen nutrition assistance benefits and to reopen the ACA's federal health exchanges to ensure folks who need health insurance are able to buy it through the health exchanges. Again, it's just ensuring that safety net programs that protect the most vulnerable, including the homeless and other low-income individuals, are adequately receiving resources. Updating COVID-19 surveillance data to collect surveillance systems to collect data on patients' race, ethnicity, sex, age, primary language, sexual orientation, disability status, gender identity, and socioeconomic status in line with other federal standards. Expanding the paid leave provisions that have been passed in previous COVID legislation to cover more people. And of course, reducing health disparities in access to testing and to support anti-racist and implicit bias training for providers to reduce disparities in COVID-19 care. Our next topic is climate change. Our goal is to support federal, state, and local health departments to prepare for the impacts of climate change. One primary focus is through funding CDC's climate and health program. We also support the inclusion of strong public health provisions in any broader climate change legislation that Congress may look at. We oppose efforts to weaken EPA's ability to regulate greenhouse gas emissions under the Clean Air Act, and we also oppose efforts to block or weaken existing regulations to reduce greenhouse gas emissions, including those efforts by the EPA itself, which has rolled back a number of regulations that were enacted during the previous administration. As I mentioned, APHA strongly supports CDC's Climate and Health Program, which provides tools and resources for currently 16 states and local health departments to help diagnose and prepare for the serious adverse health impacts of climate change, including extreme heat, severe storms, floods, droughts, and increases in air pollution and the spread of vector-borne diseases. APHA supports the Climate Change Health Protection and Promotion Act, which APHA has been the lead organization on with Senator Markey and Representative Matt Cartwright. Bill would require the Department of Health and Human Services to develop a national strategic plan to address the health impacts of climate change, and it would bolster federal support, research, and data collection on the health impacts of climate change. So again, making sure that our federal public health infrastructure, as well as our state and local health departments, have the resources and tools they need to address the unique threats that they're seeing from climate change in their communities. And we're also monitoring efforts in Congress as they work, as they look at legislation to more broadly address climate change, reduce carbon emissions, and other greenhouse gas emissions. The Climate Change Health Protection and Promotion Act was included in a draft House bill, a broader draft House bill on climate change, and was also included in the recommendations that were just released by the Select Committee on the Climate Crisis at the end of June. So we're very happy about that. Some other issues, I've mentioned EPA's rolling back of existing regulations. EPA recently released the Affordable Clean Energy Rule to replace the Clean Power Plan, which was the centerpiece of the Obama administration's climate change activities. The Clean Power Plan would have cut carbon pollution from the power sector by 30% from 2005 levels, prevent 4,500 premature deaths and 150,000 asthma attacks in children annually. It's currently on hold by the Supreme Court. Of course, EPA is, as I mentioned, put out a replacement rule, which is much weaker. So APHA and the American Lung Association and other environmental organizations are suing EPA over this decision. Our next topic is access to health services. Of course, we've been fighting a long battle to uphold the Affordable Care Act and support efforts to build upon that law to expand access to health insurance coverage, support safety net programs that provide millions of people with affordable comprehensive care in the US, and of course, maintaining the Prevention and Public Health Fund, which was part of the ACA. And we continue to oppose any efforts to redirect these funds to other things that they were not intended to be used for, like tax cuts. Access to health services, the landscape, as many of you are aware, and thank you for your advocacy efforts over the last several years. In 2017, the many attempts in Congress to repeal the ACA failed. So now the Trump administration has turned to the administrative and regulatory process in an effort to undermine critical ACA protections, including expanding the use of association health plans, cutting funding for ACA programs that inform consumers of their choices, and limiting access to women's reproductive health care. APHA has also supported several bills to improve and expand the ACA during the 116th Congress. Most recently, APHA endorsed HR 1425, the Patient Protection and Affordable Care Enhancement Act, which passed the House just a few weeks ago, by a vote of 234 to 179. Of course, the Senate is unlikely to take up this bill. But the bill would expand access by encouraging more states to expand Medicaid, provide additional premium supports to consumers to make insurance more affordable, protect individuals with pre-existing conditions, and roll back some of those administration rules that I mentioned that would allow plans that are not compliant with the Affordable Care Act to be offered. So basically, plans that don't ensure coverage for pre-existing conditions or offer the essential health benefits that are required under the ACA. And there were several other similar bills related to HR 1425 that passed the House during the first session, but again, unfortunately, were not taken up by the Senate. All of you probably know that the ACA is also under threat in the courts. A coalition of 18 conservative states is using the Congress's elimination of the tax penalty or the individual mandate as their core argument in a lawsuit filed against the ACA, challenging that since the individual mandate no longer stands, that the Affordable Care Act is unconstitutional. On the other side, a coalition of 21 states, attorneys general, led by California Attorney General Javier Becerra, is defending the law after the Trump administration decided to side with the 18 conservative states in urging the courts to throw out the ACA and rule it unconstitutional. The case is now pending before the US Supreme Court. Again, you remember several years ago, the ACA was before the Supreme Court. APHA joined a number of deans, chairs, and faculty of leading schools of public health on a friend of the court brief that was submitted to the Supreme Court, highlighting the many public health benefits of the ACA, including the Prevention and Public Health Fund. The Prevention and Public Health Fund, created by the ACA, of course, it's the only mandatory funding stream dedicated to improving public health. It supports community prevention and clinical prevention programs, strengthens infrastructure and workforce, and expands research and environmental health tracking. It makes up more than 11% of the Centers for Disease Control's annual budget. And of course, Congress has the power to eliminate the fund or redirect the money to pay for non-public health related proposals. And as I mentioned earlier in the slides, APHA has vigorously opposed those efforts to divert the fund to other things that it wasn't meant to pay for, like tax cuts. Our next topic is gun violence prevention. Our two goals are to provide CDC and the National Institutes of Health with funding to conduct gun violence research. We also support legislation that would require universal background checks for all firearm purchases in the US, and we support legislation to allow for extreme risk protection orders to remove guns from dangerous individuals. Gun violence is a leading cause of preventable death in the US and a public health crisis. In 2017, more than 39,000 people were killed as a result of gun violence. And of course, tens of thousands more suffered non-fatal injuries. APHA is advocating for a comprehensive approach to address the crisis. We strongly have supported HR 8, the bipartisan background checks of 2009, which did pass the House of Representatives in 2019. Unfortunately, the Senate did not bring up that bill. And we have also strongly supported funding for CDC to conduct public health research into firearm morbidity and mortality prevention. The final fiscal year 2020 spending bill contained $25 million split evenly between CDC and NIH for gun violence prevention research. APHA has joined with its partners in the public health and healthcare arena to urge Congress to provide $50 million in total to CDC and NIH, so $25 million each for fiscal year 2021. And I'm pleased to report that in the House version of the Labor HHS Education Appropriations Bill, which funds CDC and HRSA, $25 million is provided both to CDC and NIH for this research. Of course, the Senate still needs to act on their version of the bill, but we will continue to push for this level of funding. And then last but not least, APHA has spent quite a bit of time over the last few years opposing efforts in Congress and within the administration to weaken existing public health regulations. And we've weighed in with agencies to advocate for strong public health protections in key rules and regulations. As many of you know, federal rules play an important role in protecting the public from serious health threats, including deadly air pollution, toxic chemicals, food contamination, and workplace injuries. And we are working to maintain the integrity of federal regulatory process to protect critical public health regulations. Some of the various threats we've seen over the last few years, the Trump administration implemented a final rule to restrict Title X funded providers and facilities from providing or referring for abortion services. USDA scaled back school meal improvements that were passed a number of years ago and implemented in the last administration. APHA, certain organizations took USDA to court over this. APHA did submit a brief supporting the effort to block USDA from weakening these standards. And I'm pleased to tell you that a federal court agreed and did strike down that USDA rule. You can link to a blog that was written about that. The Clean Power Plan, as I mentioned, EPA repealed the Clean Power Plan and replaced it with a much weaker proposal that will likely increase emissions of carbon dioxide and other key pollutants such as sulfur dioxide and nitrogen oxides. And APHA and ALA are taking legal action against EPA's final rule. And the mercury and air toxic standard for power plants, EPA's final rule would recalculate the costs and benefits of the rules, drastically lowering the estimated benefits, threatening the rule and making it harder to strengthen the rule in the future. The EPA is now declaring that the mercury and air toxic standard is no longer appropriate and necessary. And so APHA and other health and environmental groups are suing EPA over this decision. So that is an overview of our priorities for the year. With that, I'm going to turn it over to Jordan so he can walk us through our tools and resources that we provide for engaging, and some how-tos and tips for engaging in grassroots advocacy around our priorities. So Jordan.
Hi, everyone. So I am sharing my screen now. Okay, there we go. Okay, so I'll just be discussing a little bit, following up with where Don just left off, the importance of APHA's advocacy on these priority public health topics and how you can get involved in that advocacy. So starting out, we can talk a little bit about what advocacy is and the role that APHA plays in the advocacy environment. So advocacy is a way that you can lend your voice to the national conversation on any given issue, but in this case, public health. And that's a conversation that takes place in our neighborhoods, our communities, our homes with friends and family, and very importantly, with Congress. So when you lend your voice to advocacy efforts, you are not just helping inform the people around you, but very importantly, to educate and incentivize Congress to move on issues that are important. APHA takes a role in advocacy as the #1 public health advocate. So we are the primary voice for public health advocacy and different public health issues. And APHA takes advantage of our members' public health expertise to champion the health of all people and communities. And our members and affiliates play a role in APHA's advocacy, one, by amplifying APHA's priority issues and bills, also by lending your own public health expertise in whatever topics that you work on to that advocacy, as well as using your role as a constituent in the states and congressional districts that you live in to reach out to your congressional members and tell them why public health is important in your congressional district specifically. So as you can see here, data shows that grassroots advocacy actually works. So 83% of staffers cited personal reasons as a main driver of their members' decision making. Oftentimes, decisions come down to communication with staff or personal decisions, which is why member decisions can be influenced by grassroots advocates just as yourselves, especially when communication from those advocates are thoughtful, personal stories, and of course, evidence-based, which is what we're all about here. Now, moving on, the data also shows that grassroots advocacy and engagement by constituents specifically has the greatest influence on a member of Congress and their decision making. So to take advantage of your constituency in the states and congressional districts where you live, APHA provides a number of tools and resources for how you can reach out to your members of Congress and communicate to them on these priority public health issues. And that doesn't always even require coming to DC, even in a regular year, but especially in 2020, of course. A lot of meetings, of course, as I'm sure many of you are used to by this point, will be taking place on Zoom, on phone calls, and other virtual platforms. And we will be discussing some of the resources that we can provide to you to make this whole process easier for you. So getting into the details of the Speak for Health campaign, Speak for Health is a campaign that's all about getting our members involved in advocacy. It begins in the summer and lasts through the fall. It's an opportunity for both affiliates and APHA members to get in touch with their elected officials and enhance the collective public health voice, stemming from people who drive the public health conversation because they're public health professionals with expertise in these topics. Okay, so going over some of the resources the APHA has to provide to you through the Speak for Health campaign, one of the things that we provide is a list of questions called Public Health on the Ballot. And these are questions for candidates who are running for office this year. And they're questions related to public health that you can ask to people running for elected office or for Congress when you're attending town halls or virtual town halls. And they're just issues to keep in mind when looking at somebody who's running for a seat and thinking, how does public health play a role in their platform? Do I want to elect this person, or do I want to elect somebody that's more invested in promoting the public health and well-being of our communities? We also have some public health on the ballot graphics that you can use on social media or once again during town halls to further your advocacy. Also, for your own knowledge, we have issue fact sheets. These are fact sheets that give a rundown of evidence and data on issues that are APHA priorities, like public health funding, climate change, and gun violence. Feel free to use these issue fact sheets when you're reaching out to members and elected officials as you're talking about these issues. We also have another kind of fact sheets. These are state fact sheets, and they have breakdown information on all 51 states, the 50 states plus DC, of course. And you can use those fact sheets specifically when meeting with your members from those states. Those fact sheets are being updated now based on the newest 2020 information, and those will be available soon. All of these Speak for Health resources can be found at the link here in the slide, or you can go to APHA's Speak for Health page on our website, and it's all available there as well. There's some other resources which I'll be going through in the next few slides as well. So here are some more advocacy resources that we provide to you to help boost your involvement in the Speak for Health campaign. So here is a list of resources that you can use as you are setting up and engaging in congressional visits that walk you through just the progression of doing so. So how to contact a congressional staffer, how to write up an email to them and request and set up a meeting, as well as some tips for meeting with a member or their staff. As I'm sure many of you know, You don't always get to meet with a member because their schedules are, of course, very busy, but sometimes meeting with a staff member can be just as effective because they are able to pass that information along to the member. We also have some do's and don'ts for your visits / Zoom / phone calls, which I'll be walking through here. So just some tips for people who have engaged in Hill meetings in the past, or if this is your first time, here's just some helpful tips. One very important thing to do is confirm logistics with the staff in advance. So whose Zoom are we using, or if it's a phone call, whose phone are we using, making sure that you have the right time, especially if you're in different time zones. You want to make sure that you're all talking about the same time zone. And leading on from that, make sure that you start and join the meeting on time to be respective of the staff and the member, as well as your time as well. You definitely want to be concise. It's important to infuse your advocacy with personal stories and your own professional opinions about how these policies that you're discussing impact your community, impact your friends and family, have even impacted you, but you definitely want to do so in a concise way and remain polite and professional and not wander on other issues that maybe aren't on topic. You definitely want to plan ahead as well if there's multiple people involved in the meeting. So think ahead of time about who is going to speak about what issue in the meeting, what order you're going to go in, and make sure that you avoid speaking over each other because you want to present a solidified front to the staff that you're meeting with to get your point across. Some more tips is that you definitely want to be prepared to answer questions because you have to realize that you as a public health professional are probably, if not definitely, more educated and informed about these issues than the staff member. So you definitely want to be ready to answer any questions they have, or if you don't necessarily know the answer to a specific question, have some resources, fact sheets, or studies ready to link them to and say, you know, if I don't know the answer to that right now, here's somewhere you can find out, or I can find out and get back to you. Continuing from that, you want to make sure to offer yourself as a resource to the elected official and their staff. So try to conclude the meeting and say, you know, if there are any questions that I haven't answered today, I want to be a resource going ahead into the future, not just on the bills or issues that we talked about, but anything related to this issue that you think I could offer advice for. Once again, you want to provide material to support your position. This is where a lot of our fact sheets will come in handy. So if you're going to an office talking about funding for gun violence, make sure that you have either printed or emailed to them one of our fact sheets on gun violence and funding for gun research, because not only does that provide them with a resource to go through as you're going through the meeting, but it helps inform you as well. And of course, as always, follow up with a thank you email, giving them links to any of these studies or fact sheets that you mentioned in your meeting, and once again, offering yourself as a resource to their office. One of the biggest ways that you can engage in advocacy through APHA without ever even setting up a meeting or talking to anybody at all is our action alerts. So you can find our action alert page under the advocacy tab on our website. And this is a very important but also really easy way to get involved with advocacy. If any of you have filled out our action alerts before, you know how easy it is. And if you haven't, go to our action alert page today, try it, fill out an action alert and see how easy it is. So basically these action alerts are pre-written messages on specific APHA priorities, but very importantly, they can be customized based on any professional expertise or personal experience that you have. So personalization is key because obviously you as public health professionals have a depth of experience in the issues that we are talking about here. And when offices are receiving these letters, these action alerts, contrasting between 100 of the exact same letters that they get versus 100 different letters that they get, offices are going to pay more attention to 100 different letters, each with personal stories, professional opinions, as opposed to they received 100 letters that are all exactly the same. Volume of letters is absolutely important, but when you add your own personal touch to these letters, it makes the staff in those offices much more likely to pay attention to that information and pass it along to their boss. So you definitely don't want to miss the opportunity of writing your own personal story in an action alert. And you definitely want to use that opportunity to be specific. So talk about how it's impacted you, how a bill has impacted your work, how it's impacted your community, whatever the issue is. Also, always keep it evidence-based. Of course, the more evidence, the better. And here's a list of specific resources that you can use as you are engaging in setting up meetings or listening to town halls from members. So the first resource we have here is the Speak for Health page. That just includes a lot of information about the Speak for Health campaign, as well as different Speak for Health resources. We have fact sheets, which are both issue specific and state specific that you should definitely feel free to use in any meetings that you set up. We have infographics, which are great not just for meetings, but as well as for posting on social media, which is a huge part of this. You want to make sure that you're engaging in the Speak for Health campaign on social media, talking about any meetings that you're setting up, talking about any town halls that you're attending, to get everybody on social media engaged in this as well. We also have some reports and issue briefs on different APHA priority issues, as well as our monthly legislative update, which is linked here. Our legislative update is a great rundown of what APHA has engaged in on the advocacy front in the past month. And we have those for every month going way back. So this is a great resource if you're looking to see before you're setting up a meeting, what has APHA done on a specific issue? So if you want to set up a meeting and talk about gun violence or maternal mortality, feel free to refer to our monthly legislative updates and look back and see, okay, here are the instances where APHA has engaged on these issues, and I can bring this up in my meeting or in a town hall or whatever. So that's definitely a great resource. We also have an annual congressional vote record that gives a rundown of votes on certain issues that you can, once again, feel free to point to in the meetings that you're setting up. Our APHA policy statements are a great wealth of evidence that you can point to in your meetings. We have policy statements on almost every single health issue that's out there that you can think of. Just go to the policy statement database, type in the keyword that you're looking for, and more than likely you will find something related. Two of the great things about our policy statement database is that, one, they are all approved by APHA boards and full of evidence. So this is a great place to look for different studies that lend themselves to your discussions with members, but they also have action steps. So if staff reach out to you and say, hey, we would really like to do something on maternal mortality, but want your advice. These policy statements all have action steps that give suggestions to members of Congress, for instance, on what action can be taken to address these issues specifically. Moving on, we also have a webinar link here that you can check out and join some of our upcoming webinars to inform your own advocacy, but also feel free to invite the Hill staff that you're having conversations with to these webinars as well, so they can learn about these issues.
Jordan, if I was very excited about all of these opportunities, and I didn't have the slides yet, but as soon as this call was done, I was like, yeah, I want to take action, but where do I find any of those?
The slides specifically?
No, where do I find the links? Where do I find Speak for Health information? Where do I find the fact sheets?
So these are all on the APHA website, but we can also send out the slides afterwards, so you have access to all of these links.
Awesome, thank you.
Okay, and also for anybody who's watching, this whole webinar is being recorded as well. So if there's any information that you feel like you missed, feel free to go back and watch the recording after we send it out. And here are some more resources for you guys to use. You can't say that we didn't give you enough resources. So this link here has a list of letters that APHA has joined and sent to Congress, to the White House, and to different federal agencies on a range of different public health issues. And they're sorted by month, so you can go back from most recent to further and further back. This is also a great resource once again, similar to the monthly legislative update. If you're looking for specific issues the APHA has engaged on, you can check out these letters for specific things. If you're looking for nutrition advocacy, feel free to comb through the letters that we've posted and through our legislative updates and see what we've done on nutrition or whatever issue you're interested in. We also have here regulatory comments if you're interested in how we've engaged with the federal agencies. If you're interested in how we are involved in congressional hearings, we have a link here on the testimony that we have submitted and been involved with for congressional hearings. And of course, beyond just Congress, the courts are just as important as ever. And so here we have a link to briefs that APHA has joined and submitted to either support or oppose different public health court cases. So between all of these resources, you should be able to see the advocacy that APHA has engaged in and be able to mention that in the meetings that you are involved in, or not just meetings, but town halls. I want to call out town halls specifically because town halls are always a great time to ask your member of Congress questions. But specifically this year, I have personally noticed, and maybe you guys have noticed this as well, but I've noticed several members of Congress are having an increasing amount of town halls to stay engaged with their constituents during the COVID-19 pandemic and make sure that their constituents feel like they're being heard throughout this. So that's just more opportunities than ever to join these virtual town halls and stay engaged with your members of Congress on these issues. So moving forward, here we are just going to discuss some suggestions on how you can get involved in advocacy this year. So APHA has some Hill visits that we have each year at our mid-year meeting. But in addition to the mid-year meeting going forward, feel free to join our action alerts. Feel free to talk about Speak for Health on social media to your friends, your public health colleagues, and to anybody else that you want to. Tweet your member of Congress. It can't hurt to do so. And finally, just setting up virtual visits through phone and Zoom and joining virtual town halls, especially during recess, which is coming up this August, which is a great time to try to set up those meetings with your members of Congress. So that is all the tips and resources that we have for you guys. Lindsay or Dawn, if you want to chime in and add anything, feel free. Otherwise, we're happy to take questions at this moment.
Y'all, you can feel free to unmute yourselves, or you can type your questions in the chat. I will monitor the chat so that Don and Jordan don't have to try to read and answer at the same time. But this is a great time if you've got questions about like what's the best way to approach your member of Congress. How do I get them to care about the stuff that I care about? If you are me, I live in DC. What do? I don't have representation in Congress. These are all great questions to ask. And I see, oh, hang on. Martha from Colorado asks, might you consider recasting your individual policy issues into 2 overarching principles and recognize megatrends in 2021? Oh, hang on, let's see. The degree to which a proposal materially contributes to the control of the pandemic or reduces the impact of racism. Oh, so how do we tie in COVID-19 and racism to all the other issues that we have going on?
Yeah, so unlikely we would do that as APHA, but I think you as an individual APHA member could certainly do that. When you're making your pitch for these issues, I think bringing both of those really important issues to the table, particularly when you're talking about public health funding, I think is a great example. Obviously, as you said, those are the issues that are top of mind for a lot of folks these days. So yeah, I think as an individual public health professional who has experience in those topics, kind of bringing that light to them would make a lot of sense. Jordan, I don't know if you have anything to add to that.
Yeah, I think that's a great point. And I think especially this year, I hate to be the person saying like, public health is more important than ever. But it's true that a lot of members of Congress are keenly aware of this issue more than ever because of COVID-19. And specifically, I think a lot of people in the general public, as well as members of Congress, have gained an even greater appreciation for what public health professionals do to protect and maintain the well-being of our communities. So this is a moment in time where you can really use the respect that people have for you at this moment to press your members of Congress to listen to you and to take action to improve the health and well-being of our communities.
Yeah, and I just also want to add that the focus of this webinar was on our priorities, advocacy priorities for the year. But you could ask Jordan or I, and we could rattle off 50,000 other topics and issues and bills, and many of, some of which that have been mentioned in the chat that we've also weighed in on. So again, it's another good reason for you all to really read those legislative updates, check out the website, the letters and comments that we send to the Hill and to federal agencies and other parts of the administration, because we do weigh in on many other issues beyond the advocacy priorities. Lindsay, I'll just take this next question. Are there organized APHA group advocacy efforts at the state level? Maybe. I think it's dependent upon the members. APHA doesn't have the capacity to do that or coordinate it, but our affiliates, I know many of our affiliates do engage in advocacy, so it's a great opportunity. If you're a member of APHA and maybe you're not a member of your affiliate, think about joining your affiliate, or at least reaching out to your affiliate to learn what they're doing. I know a number of affiliates that do work on issues at all levels, federal, state, and local. So now obviously some affiliates have more capacity and capability than others, but it's always worth checking in. And of course, if you as an individual APHA member are interested, the Speak for Health campaign is a great opportunity for you to try to coordinate with other APHA members within your state, going to your section, going to your affiliate to try to identify folks who live in your region is a great place to start.
Hi, this is Fran, and I just wanted to chime in as far as that's one of the reasons why we bring the affiliate president-elects and the section chair-elects together to create some form of collaboration so that you can work with one another, bring APHA members with affiliate members to tackle these issues that have been mentioned for Speak for Health, as well as one of the things that the Intersectional Council, as well as the Council of Affiliates, they're looking into is bridging that gap. And like one of the things that I definitely like to recommend is that if the affiliates are doing something in terms of advocacy, definitely utilizing APHA Connect. That is our online platform, and we do have a community for every single state. So that would be a great way to work together. Also, like this was a good segue, Dawn, as far as one of the things that we are working on is really trying to have our APHA leaders become affiliate leaders. So we will be kicking off a campaign in a few weeks trying to make sure that our APHA members do become affiliate members, and like it makes it even easier and better and stronger for us to have a voice on public health when we're aligned. So I just wanted to mention that also.
Yeah, and the last thing I'll say along the lines of this this question is that we do have great examples over the years of affiliates that have done some really incredible things during the Speak for Health campaign, formerly known as the FACT campaign, where they've invited, now this obviously won't be possible this year, at least not in person, but they've invited members of Congress to come visit them, and they've done roundtables with them. They've taken them on tours of the projects and programs that they're working on that were funded with federal dollars in their communities. So, there are definitely things you can do back in the States that have a much bigger impact than Jordan or I going up to Capitol Hill or sending a letter to the Hill. While those things are important, it's even more important for members of Congress to see what's happening on the ground in their state related to the priorities that APHA is working on. So that's a great opportunity to highlight the stuff you all are working on as public health professionals as well. And if you ever do that, please let us know. It's a great thing for us to know about, and it's also something that I know affiliate affairs and component affairs are interested in, and the nation's health likes to write stories about these types of activities as well. Our public health newswire has featured advocacy efforts like this in the past. So it's a great way to highlight and showcase your efforts. It's a win-win.
Yeah, and if you ever don't know who to contact, you can just send it to affiliateaffairs@apha.org and it'll get to me, and then I'll get it to the right person. You can also send it to my account, lindsay.wahowiak@apha.org. I think most of the affiliate leaders have that. Hopefully they haven't marked me as spam by now, because I do show up in your inboxes more than occasionally. Does anybody have any other questions for Donna and Jordan?
And I'll just make one more plug. You will be hearing from your action board representatives over the next several weeks. We'll be encouraging them to send reminders about the Speak for Health campaign and to redirect you back to this webinar and to the resources that Jordan went through that are posted up on the APHA website, so you can put those to use. And again, please let us know what you're doing, or let your action board member know if you do undertake some activities. Last year we did a contest to get a little competition between the sections and the affiliates broadly, not sections against affiliates, but everyone together, to highlight how much their groups did during the Speak for Health campaign. And it can be as easy as, like Jordan said, 50% of our section did an action alert during Speak for Health campaign, or it could be, 10 of our members of our affiliate or our section, or a combination of the two, attended a town hall, and we asked a question about, this public health priority X. So just highlighting those things for us is really helpful for us to know about.
Well, I see Fran has said, don't forget to use your state online community to engage APHA members in your state. For example, she's got the Maryland Connect. Now, you do have to be an APHA member to access Connect. So I do want to make that clear. So make sure you've got at least somebody, your ARGC or your president of your affiliate has to be an APHA member. Well, both those people do. So you have at least two, but you should have more, hopefully, who can access and make sure that all of that is firing on all cylinders, so you're reaching as many people as possible.
All right.
Okay, well, seems quiet. So I think best thing to do right now is to thank Jordan and Don for their time and their expertise here. Thanks, guys. Really appreciate it.
Thank you. And you'll be hearing from us soon.
And for those of you who are affiliate leaders,